Welcome to my YouTube channel. Thanks very much for the subscription. For those who subscribed, those ones who have not yet subscribed, please do one thing: subscribe, put on a notification, and we continue to learn, continue to enjoy the facts of medicine and life. Today, we are going to look at a very important class of drugs, and these are the drugs we use in the management of seizures and epilepsy. And these drugs are categorized into two. There are those ones which act on what we call inhibitory GABAergic synapse and those which act on excitatory glutamatergic synapse. We are going to start with those drugs which act on excitatory GABAergic glutamatergic synapse. What we are seeing here, we are having our presynaptic neuron, and down here we have our membrane, which was derived from a postsynaptic neuron. So we are having different types of drugs with different sites of action, and we are going to see how each affects the process of nervous stimulation and aid in treatment of seizures and epilepsy. So I'm going to start with a class of drugs, and these drugs act on what we call voltage-gated sodium channels. The drugs that act on voltage-gated sodium channel inhibitors, and they are classified into two. There are those ones which have a fast kinetic in inhibiting these receptors. Examples of phenytoin, carbamazepine, lamotrigine, oxcarbazepine. Then we have one exception of lacosamide, which has a slow kinetic in the inhibition of the process of opening of these channels. Then we have another drug which acts on the synaptic vesicle, that is levetiracetam, and when it inhibits this vesicle from fusing with the presynaptic membrane, we are not going to have this glutamate being released in the synaptic cleft. So we shall not have any further nervous stimulation and conduction. We have another kind of drugs that act on the AMPA receptors. They are AMPA receptor blockers. Examples of perampanel. There is a new drug which is a prodrug of perampanel, that is terampanel. Then when we go to N-methyl D-aspartate receptor, we have drugs like felbamate, and another important drug we have here is magnesium sulfate. We use it in treatment of pre-eclamptic and eclamptic seizure in pregnant mothers. Then we have gabapentin and pregabalin. These are GABA analogs, but they have another effect. They can bind on alpha-2 delta subunit, which acts as an auxiliary subunit of the P2 type calcium channels, inhibiting them, thus inhibiting the conduction. Another drug is a drug which opens the KCNQ potassium channels, and that is retigabine. So in this part, we are going to be looking at the anti-epileptic drugs which act on what we call the inhibitory GABAergic synapse. In the first session, we looked at those ones which act on excitatory glutamatergic synapse. Now here we have different types of drugs. We have those ones which act on GABA transporter 1. These drugs which act on this type of synapse, they are referred to as GABA potentiators. We are going to start with those ones which act on the GABA A receptor, and we have benzodiazepines and barbiturates. Benzodiazepines, they increase the frequency. Both of them, barbiturates and benzodiazepines, they are positive allosteric modulators of GABA A receptors, and they facilitate opening of GABA mediated chloride channels. So benzodiazepines, they are going to increase the frequency of opening of these chloride channels, and barbiturates, they are going to increase the lifetime. How long do these these channels going to keep while they are open. Examples of barbiturates, the commonest we use is phenobarbital, and it is preferred in babies because it has reduced effect on respiratory depression. Then here we have drugs like diazepam, we have midazolam, we have clonazepam, we have lorazepam. So another drug we are going to look at here is tiagabalin. Tiagabalin is a lipophilic blood-brain barrier permeate analog of nipecotic acid, and it is going to act by specifically inhibiting GABA transporter 1. So we are not going to be having GABA uptake due to inhibition of GABA transporter 1. So we shall have accumulation of GABA in the synaptic cleft. So another drug we have is vigabatrin. Vigabatrin is an irreversible inhibitor of this enzyme GABA transferase, which is responsible for conversion of GABA to succinic semialdehyde. So when this drug is there, it's going to inhibit this enzyme. So we shall not have GABA being converted to succinic semialdehyde. We shall have accumulation of GABA and continued inhibition of glutamate synthesis and increased effect of GABA on these postsynaptic chloride channels, inhibiting the neurons. We're going to do a recap on all the anti-epileptic drug classifications. We said in the start, we have those ones which work on the excitatory glutamatergic synapse. Among those ones, we have sodium channel blockers, where we had those ones which have fast kinetic, drugs like phenytoin, carbamazepine. Then we had those ones which have slow kinetic, drugs like lacosamide. We had a drug called levetiracetam, which is a synaptic vesicle blocker or inhibitor. We had a drug called retigabine, which opens KCNQ potassium channels. We had gabapentin and pregabalin, which are GABA analogs, and also bind to alpha-2 delta subunit, which acts as a auxiliary subunit of P and Q type calcium channels. We had a drug called perampanel and terampanel acting on AMPA receptors, inhibiting them. We had felbamate, magnesium sulfate, inhibiting the N-methyl D aspartate receptor, which are GABA potentiators, which act on inhibitory GABA synapse. We have a drug called vigabatrin, which inhibits the conversion of GABA to succinic semialdehyde. We have tiagabalin, which inhibits GABA transporter 1, and it's a specific inhibitor. We have another drug there are two classes of drugs which act on what we call the GABA mediated chloride channels, and there we have barbiturates, and the basic example here is phenobarbital. We have thiopentin. Then we have benzodiazepines, which act to increase the frequency of opening of the chloride channels, and these ones we have drugs like diazepam, midazolam, clonazepam, and lorazepam. Thanks very much for watching this video. If you have not yet subscribed, please subscribe, put on notification. More videos are still coming out. More series of videos are still coming out on pharmacology and general medicine. Thank you very much.